wanted to go ahead and talk about what you need to prepare yourself for your post-surgery state, right? So after you have your DeQuervain's release, is if that is what you decide on, okay? I'm not saying if you have DeQuervain's, this is what's going to happen. I'm saying that if you decide to choose this option, okay? And I always tell my patients that this is an option, okay? I always let them know about all their options because I want them to know that they don't have to just live with the pain, okay? That they don't have to just continue to feel in pain, first of all, but also frustrated and overwhelmed and disappointed and fed up and hopeless. Okay, there are things that can be done. Okay, so when I talk to my patients or individuals about surgery, about whether or not to have surgery, I don't obviously push them in any direction. Again, I'm just here to inform you. So when it comes to surgery, I always recommend, again, I don't choose it for you. Whatever you decide, I support you 100%. But I do let you know that, surgery is, DeQuervain's release is a surgery. So surgery shouldn't be taken lightly, even if it's a surgery of a small part of your body. It is surgery. It is trauma to the hand. Okay, it's trauma to the wrist. And so anytime there's trauma, you have to expect that there's going to be, your hand's going to be in a trauma state afterwards. So there's going to be some pain. It's hard to say how much pain for how long. Every person is different. There's going to be swelling, which is uncomfortable, which also can add to pain. There might be some numbness, which again is expected post-surgery. It's hard to have a surgery without causing some sort of trauma to the nerves in that area, okay? There will also be stiffness and weakness post-surgery. Again, all of these post-surgery conditions, the numbness, tingling, stiffness, pain, it's hard to say how long you might have it, but these are things that could possibly happen, okay? So it could possibly happen to you. So I let them know that, again, surgery is a invasive procedure and to not take it lightly, but it's also, again, it's an option, okay? And if after conservative treatment, meaning trying therapy with a specialist such as I, an orthopedic specialist such as I, it hasn't given you enough gain back, then usually the next thing to do is to consider a cortisone shot, which I've discussed before. And if you have questions, let me know. I'll go over it again or, answer your questions. And if cortisone shots, if after 2 to 3 shots it doesn't work, then a surgery is something to consider. Now, like I said, a surgery really truly is your decision. It's not a surgery where it's life or death, where it's like heart surgery or, surgery for something that could be fatal, meaning, that surgery is a must. When it comes to DeQuervain's, a doctor, a surgeon will leave it up to you to decide. Like, is your pain so much that it's disrupting your life, that it's causing dysfunction, like you're not able to live your life, okay? It's up to you. It's up to you where your, what you can tolerate, right? How much dysfunction you can tolerate, how much pain. It's you to decide if you get to that point. So with that being said, again, it's invasive, so you want to make sure you keep that in mind, okay? So with a DeQuervain's release, let me go over that again. I know I went over that on a previous post. So a DeQuervain's release is where the surgeon will go ahead and release something. He or she will go ahead and make a small cut in your extensor retinaculum. Your retinaculum is what's underneath your skin, deeper, just beneath your skin level. The fat layer is a band of ligaments that wraps around your wrist, and it holds things in place, such as the tendons, and specifically the tendons that are injured in DeQuervain's. And so that retinaculum is very important in holding things in place, because things like your tendons work better if it's held in place correctly. Okay, so in this DeQuervain's release, the surgeon is not releasing or cutting through the whole retinaculum. Okay, he or she is only cutting a small amount. I know I said centimeters before, but even millimeters. Okay, very small amount to open up the space for those tendons that are injured so that they can glide back and forth better, which tendons are supposed to glide back and forth in a normal state in order to move body parts. Okay, so in this release, again, the surgeon is going to cut a small part of that retinaculum. Okay, now what things do you need in order to not only to heal the best post-surgery, but also to make sure that you have the most success, meaning you will have the least likeliness of your DeQuervain's returning, and it can return, okay? If you're not taking care of your hand, wrist, and thumb well, if you continue to use it poorly, overuse it, overstress it, then yes, your DeQuervain's has the potential of returning, okay? I know for those of you who are talking with your surgeon about the surgery or have already had it, this is something that maybe a lot of surgeons haven't maybe mentioned, and it's unfortunate. But me being a therapist who treats prior to a surgery and post-surgery, I do see returns of DeQuervain's pretty often, okay? I see it, I've treated it, I've spoken to individuals where they'll have a return of the symptoms, maybe even they'll actually be the percentage of people where the surgery actually hasn't done anything or possibly has worsened it. And I'm not saying this in order to scare you about surgery. I'm just saying this so that you are fully informed, okay? And so, you know, if your post-surgery program isn't thorough, then there is the possibility that you won't have the best outcomes. Okay, so it's always good to have a program, okay? That gives you the highest chance of having a good outcome. It doesn't guarantee it, okay? It just, you have a better chance of a good outcome, okay? So a program that will prepare you and equip you with the best outcome should have the following, okay? It should have, first of all, it should teach you scar management, okay, because this is for anyone who's had a surgery. Anytime that you're opened up, let me take that back. Anytime that your body is injured in any way, okay, any sort of trauma, but in this case, a surgery, anytime your body is opened up, your body will heal whatever was operated on, whatever was cut, by laying down scar tissue. And we're all, us medical experts are aware of that, okay? We know that's what's gonna happen. In some cases, we depend on that happening, okay? It's your body's natural Band-Aid, it's your body's natural glue, okay? Seals things back together. But your body will lay down more than is necessary, and so that can be problematic. It will, like I said, it can glue things together. It can glue onto things. It can take a hold on things, okay? It doesn't allow things to move the way it should or glide in regards to the tendon. So we need to have a management program to make sure that we break down as much scar tissue as possible, okay? Like I said, we want to have some scar tissue, but we don't want to have as much as what the body is going to lay down. It just kind of lays down a crazy amount, okay? So you need to have a scar management program. As much as possible, we need to soften that scar tissue on the surface, but underneath, make sure that it doesn't take hold and glue things together as much as possible, okay? So that's the first thing you need. The next thing you need is usually a lot of times after a surgery for any part of your body, there's going to be sensitivity, okay? Because again, in any surgery, there's going to be some amount of nerve damage, and that's expected too, okay? There's just so many nerves in your body. It's impossible for a surgeon to work around it or bypass it. You know, a lot of times the surgeon might accidentally cause trauma to it, and that's okay. We expect that. But that trauma is going to put your nerves into a hyper sensitive state. And so your area that was opened up is going to feel super sensitive. It's going to feel sensitive to touch, sensitive to sensation, and we want to make sure we're doing something about that, okay? Because if we don't do something pretty immediate, there is the possibility that your nerves continue to stay sensitive, and obviously that doesn't help to allow your hands to function, right? If it's sensitive, then you start to avoid things, you start to use that hand less, you start to you start to guard it and you start to protect it, which decreases the function of your hands, right? So we need a desensitization program. We need to also help encourage movement of that area of the body, not just the bones, okay, but also we need to make sure that we are helping the tendons to glide normally again, as close to normal as possible. So we need range of motion exercises that include tendon gliding, that include passive range of motion, that includes active range of motion, okay? We'll also need to do a lot of soft tissue work because, you know, a lot of the times we're working on the soft tissues because they were already disrupted prior to the surgery because of your injury, right? And now you add post-surgery state where for a few weeks you're not using your hand, right? Your surgeon's telling you to leave your hand alone. And so in that time, things can tighten up, things can shorten. And so you're gonna need soft tissue work also to help lengthen things again, okay? And to soften things again so that again, it works normally, okay? Eventually we'll be working on strengthening. That's not something we immediately jump into, okay? We need to make sure that your body has healed, okay, before we go ahead and work on strengthening of this area. You can actually work on strengthening of your core, your trunk, your lower body, again, as long as it doesn't cause stress to the hand, as long as it doesn't force the hand to grip heavy things or grip for extended periods, okay? Other things super important that needs to be taught, okay, that should have been part of your program prior to your injury is teaching how to modify how you're doing your everyday activities that might have stressed your hand in the first place. So this is a big thing, okay? Because like I said, your DeQuervain's can come back. And if we're not learning safer ways to do our everyday activities, especially ones that can leave you vulnerable to DeQuervain's, then it can come back, okay? So we wanna make sure that we're teaching activity modification, okay? So that you can continue to live your life, but in a safer way, because once you have DeQuervain's, it's in your history. It's in the history of your hand. It's in the history of your body. And it's something that we need to continuously be aware of. Okay. And I get that question all the time. How do I change my everyday things so I can continue doing it? Right? Because there's some things you just can't stop doing, whether it be a job or something you love. So, and I don't expect you to. I just expect you to do it differently and safer, and maybe with equipment to help you. Many different ways we can approach it. But yes, so your program, actually, your post-surgery program actually should have a lot of things, not just simply, and I get that question, what exercise should I do? Well, it's not just one thing that you need to be working on that's going to prepare you for lifelong healthy hands, healthy thumbs, healthy wrist, okay? There's a lot of things you need. And again, I hope to be able to be someone that you know you can turn to for all that education, the recommendations, the resources, okay? And my goal is to go ahead and make a guide on that too, a post-surgery guide. But in the meantime, do not, I repeat, do not just sit there and deal with your post-surgery pain, okay? Reach out to me, okay? Either reach out to work with me one-on-one so I can give you that program, okay? It should take just one visit, but it will prepare you for a great outcome for the weeks of your recovery. And yes, it's going to take at least a couple months, okay, before you feel normal again. And I quote that because it's a new normal, okay? But until you can feel like that's your hand again, okay? If not a one-on-one session, sign up for our virtual groups, okay? So we can go ahead and all work together on this. But yes, I hope to have that resource guide out soon, because again, I need you to have this information. I know it's not about me, it's about you, but it's definitely something that I want to make sure that you have the information on. Okay, so anyways, hopefully this was helpful and informative. I feel like I've been spending this week talking about DeQuervain's release, the DeQuervain's surgery, and I'm so glad because it's also another important topic. It's not just the pre-surgery we need to talk about. This surgery also, because there's a lot of folks who are in that post-surgery state. So, but again, thank you so much for being here. I always love talking to you guys on Thursdays, answering your questions. Reach out, send me those questions, okay? DM me, email me at rose@firstthemoms. Send me pigeon mail, something, poke me, whatever. But send me your questions, okay? It's so important. Like I said, the more you know, the better your outcomes. Okay, all right, have a great day, have a great weekend. Today is the last day of 5th grade for my oldest, and I cannot believe it. He is going to be a 6th grader soon. I'm so excited. All right, you guys take care. Stay safe, okay? Reach out. I'm here for you, okay?